Let's do a little summary of obstructive versus restrictive lung diseases. So, obstructive lung disease is when the airways become partially or fully blocked by something. That something could be mucus, such as in chronic bronchitis, or it could be that the airway is spasming, so closing off a portion or all of the airway. Could also be down to fibrosis or scarring of the lung tissue, which may develop alongside emphysema. And this will then further close off the airway. Could also be down to damage or destruction of the airways, and this is where we see floppy airways. This is often an inflammatory response, and the airways become damaged or permanently enlarged air spaces. We have air trapping in the lungs. So that is where you get bullae or air bubbles trapped in the lungs. Now, it could get damage to the bronchioles and a loss of elasticity. So this is your lung recoil, where exhalation becomes difficult. So people with obstructive lung diseases struggle to breathe out. Now, restrictive lung diseases occur when the lung expansion is reduced or restricted. So there's essentially a reduced volume of lung available for gas exchange. It could be an intrinsic or in the lung cause, such as inflammatory processes leading to fibrosis or scar tissue, or an extrinsic outside of the lung cause, such as obesity, neuromuscular disorders, which affect the intercostal and diaphragm muscles, chest wall deformities, and this is such as scoliosis, excessive kyphosis, or a combination of both. So people with restrictive lung diseases struggle to breathe in. In short, people with obstructive airway diseases struggle to breathe out. They have a low FEV1 over FVC ratio, and they have reduced recoil. People with restrictive lung diseases struggle to breathe in, and their FEV1 over FVC ratio is typically normal or high, and they have reduced compliance or stretch of the lung tissue. Please feel free to ask me any questions or clarify anything if anything didn't make sense. And I hope to be able to use this to create more educational resources about respiratory disorders and the physiotherapy input.